there are symptoms of concussion that you will traditionally see grouped together. However, one of the challenging things about treating concussion is that no patient presents exactly the same way. Indeed, some can be completely different. This variability can occur both in what symptoms are present after the concussion, as well as how quickly and to what degree that patient will recover. We'll take a closer look at symptom variability next. As we said, the way a concussion can affect an individual can vary widely. Although possible, it's rare for any one patient to have all of the possible symptoms that a concussion can bring. If a patient seems to have every possible concussion symptom, a multidisciplinary treatment team should work together to determine if the injury may have been more severe than originally anticipated, or if there are comorbidities playing a role. A more common presentation would be to have several or a handful of concerns spread across the physical, cognitive, and psychological symptom clusters that we talked about earlier. Let's illustrate this symptom variability in another way. Here we have those 11 common symptoms from concussion, grouped into physical, cognitive, and emotional clusters. Remember that any one concussion patient can have any one, two, or in rare cases all of these symptoms. A more realistic patient presentation will be to have maybe 5 or 6 symptoms across the clusters. As a theoretical exercise, I want you to put yourself in the shoes of a concussion therapist for a day. We're going to take a look at how different symptom profiles can present and apply variations of these symptom profiles to patients you may see in the course of a day in a concussion clinic. At the beginning of your day, your first patient presents to you with vestibular, headache, sleep, executive functions, and anxiety symptoms. After you work with them, your second concussion patient comes in. He has a completely different set of concerns. Oculomotor and attention deficits as well as depression symptoms seem to be causing him problems. Now patient number 3 comes in and presents with a combination of concerns from the first two: fatigue, executive function, and depression. Your day continues like this. You continue to get different presentations from each patient, all of them having only 5 of those total 11 symptoms which are possible. If you take a moment, you realize that there are 1,023 unique combinations of symptoms that could potentially present to you. And that's only with up to 5 symptoms. If each patient had 6 symptoms, now you're talking about over 1,400 different combinations, and it just gets more complicated from there. Now I realize this is an extreme example, and there are many mitigating factors that would affect a reasonable number of possible variations you may see. However, hopefully this example does serve a purpose in illustrating just how variably a concussion can affect each patient.